Right. So thank you all for registering for the Open Dialogue, Dialogical Practices and its Application in Crises workshop. We have Dr. Pina Ridente leading this session. Dr. Pina has specific expertise in psychosocial rehabilitation, supported housing and co-production, and as a certified open dialogue trainer and supervisor from the University of, I'm going to have a hard, Finland. She's currently involved in training courses and supervision in Italy and at BALM, as well as in other sites. Welcome, Dr. Pina. Thank you. Yes, please. I also invite onto stage Dr. Anbu Dorai, who's a psychiatrist with a flair on working on mental health issues from the Banyan. Thank you, Dr. Anbu. I also request Keerthana to please come on stage. Keerthana is our excellent and fantastic lead for program implementation at Chengalpettu, leading all operations. For folks coming in, request you to take your seat silently since we're starting the program and try to come up front and occupy the seats up front. I'll now request Dr. Pina to come up and start the presentation. Thank you.
Hello everyone back, and I can imagine that we are all a bit exhausted. The two sessions this morning were really fantastic, very interesting, and took all our energy. I hope you have still a bit left to be here with us. We are going to share some information about the open dialogue approach. We decided to start with this first part that is definitely not dialogical, it's just monological, with me talking to you about the approach. But we thought that maybe not many people here in the room know what open dialogue is, so maybe you need some short information, and then we will go on in a conversation between us and all the other people that would like to take part. So, the open dialogue approach started in the 80s in Finland, North Europe. The first information I would like to give you is that this approach is not just a psychotherapeutic approach. It's a system, it's an integrated community-based treatment system. It means that give where it is used in Finland, because it's not used everywhere in Finland, just in some places. Where it is used, satisfy the mental health needs of the population, not just giving some setting of psychotherapy. And give me the chance to share with you something personal. I mean, some people ask me, but why you coming from such, as was defined this morning, robust and complex system like Trieste, why you were fascinated from this other different system? Well, I think the answer to this question is especially in the last session of this morning. We are living times that are not very easy, politically, socially, economically. So mental health is increasing and medical approach is increasing. So I think it's very important and useful that all, as was said, especially the humanistic approach, and open dialogue is one of the humanistic approach, create bridges, create link, create connection. We can learn from our neighbors, and we can improve our system, whichever it is, learning the best from the other approaches. I think it's not a coincidence that open dialogue approach, Trieste system and Banyan system are included in the WHO guidance for best practices, together with other very good practices in the world. that was added 2021, so quite recent. This because these three approaches and the other best approaches have something in common, that is the humanistic way to approach the issue and the people, right-based, putting in the center the person, and what I would add, responding to the real needs of the people, going towards the needs of the people, and knowing Trieste, knowing Banyan, and knowing Open Dialogue, I've been in Finland, I can say that are for sure these three systems that follow the needs of the people, going in the house of the people. So this is very, for me, is very meaningful. I think each one of the good experience can really learn something more from the others. For example, for me, what really attracted in Open Dialogue approach was their putting a bit more attention than, for example, what we did in Trieste on the therapeutic way to go together with the people. In Trieste, we are, I think, very clever in creating the institutionalization of the big, small institution. We develop a knowledge on this. In Banyan, for sure, as was said this morning, has a specific knowledge in involving community, creating social capital. Dialogical approach has, for me, the knowledge to create a bit more systematized psychotherapeutic approach that is not a technique, but is a way to approach in a very humanistic way the person. So this approach has for sure some roots behind, that are some clinical roots, of course, epistemology of the origin of the mental health illness. If you think that is organic, you think that the treatment will be organic drugs. In Open Dialogue, they think that the organic base of the psychosis at the sample are not so important, but are much more important the psychosocial origin, like a traumatic origin, like a bad communication in the relationship, or a bad treatment. And so the response, the treatment will be centered on the improving the relationship, improving the communication into the relationship. There are organizational roots started in the 60s from this need-adapted treatment that try to close the psychiatric hospital, moving from the psychiatric hospital to the community-based services. And they didn't close completely the psychiatric hospital, as we did in Italy, but now they have just very small, 10, 15 beds into some wards that are for acute. And has philosophical roots. The first is Bakhtin, that is a Russian philosopher, that emphasized the intrinsically dialogical nature of thinking, knowing, and existing. When we're born, we have two needs fundamental: eating and communicating. Many research shows that without one of the two, you will die or just don't develop. And the other philosophical or cultural background is the collaborative learning theory, that is the learning in between peers. And this is transferred to the therapy, so became the collaborative therapy, Arlen Anderson, USA. And which is the meaning of collaborative theory and therapy? That the therapist is not anymore the expert that is overall and is there to say the truth, to address the patient client, to say you have to do this, you have this wrong, and you have to change these other things. But it's just a between peers with different knowledges. Each one, therapist and client, bring their own expertise together. This is one of the reasons for what open dialogue is very welcome, is really peer supporter, family members, users. They really like this kind of approach because they find this different way to be together in between client, therapist, professional, and client. So the professional is the one that show himself or herself in an attitude of not knowing. I know what I know about my profession, but I don't know the situation better than you that are the protagonists of this situation. And the other point is that the inner thoughts, the emotions are allowed to be expressed. These of course are part of the communication. So open dialogue approach is one of the most studied approach in the world. Are more than 30 years that are done research on, especially from Jaakko Seikula, that is one of the top guy of the situation. And there are many criticisms about their research because they say are not enough number of enrolled in the research. There is not a comparison with other experience. Anyway, these are the result of their research, that even 85% of the people that get in touch with the service are recovered. 84% turn to a full employment. Of course, in Finland they have a very good welfare. Only 50% of chronic problems, and there is a going down on index of the schizophrenia or psychosis. So these are very encouraging data, even if, as I said, could be criticized. These are the main principles of the open dialogue. I can say that the first 5 principles, Banyan, the people working in Banyan, the people working in Trieste, they know exactly the meaning of these principles. Because as we said, there are some similarity into the organization and into the goal of the organization that support the people in their environment following their own needs. So immediate help, social network, so start as soon as possible with the family member, the setting, from the first meeting, the family will be involved. Flexibility and mobility, so be there present as soon as possible, taking the responsibility and giving continuity to the support. These are, I think, principles that for all the situations that really work into the community, the organization somehow guarantee. Are very new for different kind of organization that are not present into the community. For me, for us in Trieste, what we found different and useful to learn were the last 2 principles, tolerance of uncertainty and dialogue. I want to underline before that these principles are not just invented, are the result of some research. What really helps users, coming from interview, whatever, to the users and professional. So tolerance of uncertainty is really interesting because it means that you prepare yourself and put yourself in the condition to be open to the meeting with the uncertainty of that meeting with another person. You don't know the other person. You cannot pretend that you know all. So you are there giving time for what is possible to start a proper connection and to find together the right solution. Now I'm afraid also here, but for sure where I live, the first intention of professional is to find a solution, to give the right diagnosis, the right medicine, and that's all in the place that doesn't function very well. Other place maybe is completely different. So being ready to tolerate this uncertainty, create a different kind of space between the client and the professional that could be filled from some true story happening in the meeting. The dialogue is the main tools. Just so simple dialogue. In reality, is not so simple because we are lost a lot the ability, the capacity to talk each other, especially in the services, public services, and so to give the right time to the listening, the right space to the people to feel safe, to talk and express words that maybe they never found the courage to express, could be sometimes very, very helpful and healing. When you really feel listen, became very empowering. Because if you feel that someone is really listening, you feel much more powerful. So the main tool is the setting is the treatment meeting. This is another very interesting for me thing, innovation. All happen in the treatment meeting. Nothing else out the treatment meeting. When the professional meet the family, the client, all together, every decision will be taken into this meeting. No one is going to talk about this situation out of this meeting. So it means that the client, the family can develop a bit more trust. Nothing is happening behind. Even something that they don't like. Okay, I think you need some days being in a place for rest a bit, but it's taken in the presence of the client, not behind him. So this allows to a bit more trusting situation growing. In the treatment meeting, another instrument very useful is the reflecting team. Okay, when the professional turn in the presence of the family and reflect about their doubts, their fragility, their preoccupation concerning, and asking even some help. So the transparency became another criteria very important and very democratic in the situation. There are, of course, some rules among professionals, but it's just to mention because these are the tools, the skills to learn, that when you listen really attentively and not thinking to something else, and when you talk, just stay there in the present, here and now with the person, and talk in a speculative manner, not saying truth every time, like you know all, but just wondering, because the main goal is to give space to the family to express themselves. It's not the main goal, me, therapist, talking, but listening. So this change of perspective, I find this change of perspective quite interesting. Give time to the family to ponderate, to think about. Don't stay there to say, you are right, you are wrong, we need to change, but trying to be positive not in a new age way, but to really find the positive side of the situation, to encourage, to develop some hope into the family, and no blame, no criticism. The person talking with you is saying her own truth. We have to respect, because this is another main principle, the respect. Respect the person in the whole situation and person, respect not as an ethical principle that is important, not as a personal choice as professionals, but as a specific skill. You have to learn to be kind, respectful at first. Then there are all the other skills. So in this sense, it's not a technique. It's something really, is really a humanistic approach, because are simple things apparently, but I think we have lost mostly of this thing. And then last is the possibility for professional, and this allow also the people to express their emotion. It's not forbidden to express your own emotion if it's useful for the client. You are not there to talk about yourself, but if it's useful for the client. What is not? Is not a method, because allow different kind of methodology to be together, inclusive. Is not a model, because can be declined in a different place in a different way according with the different situation around. So can be something more that you can add to your way if the first five principles of the organization are satisfied, of course, because that five principles are really very important. As we said, it's a democratic approach, because say I don't talk if the client is not there. It's quite democratic. It's very democratic, I think, and giving space to everyone, facilitate for what everyone has space to talk, and don't putting yourself upper than the clients, and will be the client leading the agenda. Normally it's the doctor leading the agenda, is professional leading the agenda, but just the clients leading the agenda. When, where, how we meet, with whom we meet, what are we talking about? The first question is, who would like to start? So will be the really what the client has in his or her own minds that will come up at first. Well, this just to, in a therapeutic meeting, it's very difficult to evaluate a therapeutic meeting. There are many papers, but they find very difficult to evaluate what make a meeting useful and therapeutic for the client. There are normally two parts. One is the narrative, the story that is told through language, but the other is the embodied side, the body. The body with the posture, the voice, the face, and it seems that 90% of the communication pass through the body, the posture, all these kind of things. Only 10% from the words is much more important how the therapist says something than what really is saying. So putting some attention on this could be useful. Stern, Boston School, infant research, he says that, okay, the interpretative technique is very useful, language again, but there is something more. To make a meeting therapeutic needs something more. There is something more that really happens, and this something more is the emotional sharing between the therapist and the client. So to improve your skill in the dialogue means also to improve your ability to express, to understand and to express this emotional side in a way that is useful for the meeting. Just a small cross. David Moss, a researcher from London that is involved in open dialogue, is doing ethnographic research connected with a big research Odyssey on dialogical approach. And he just shared with us a couple of information about this research. He's saying that what makes dialogical approach very functional, useful for clients and for professionals is first this a humanistic approach. Then because it emphasizes the network, and so the client feel that the support of the network. Then for professionals that they feel that can express their emotion, and for the clients that they feel kind of close to friendship with the professional. So I discovered this old slide about Topor that study the recovery process. There are others that study the same, Davidson, Strauss. In his research, he arrived to this conclusion was 2005. So what really helped people when between professional and client there is a relationship, a kind of friendship. when something changed that make a bit more personal the relationship, and when it's possible to express your own emotions. So again, there are some bridges between things that are quite similar. To conclude, of course, there is always a but, there is always something that to which we have to put some attention. As Foucault teaches us, the word is not neutral. There is the power of the word, and there is the power of the person that say that word. So we have to remember this. Means that these differences of power in between the people talking can affect the dialogue itself. So the dialogue is not neutral, is not clean from this risk of power, and so we must be really attentive. I leave you with this motto of someone that is very close to you, Mahatma Gandhi, that I find very inspirational. Thank you. To show you a very, very short video. Is not very refined, because we did just 10 minutes ago with help of Nagaraj Sir a short imagine of
has definitely improved the state. For me, I think listening has definitely improved
I cannot understand. Just during the course, I put a question: what was really changed for you learning this approach, personally and in your work? And these are some of the answers during the course. Thank you.
For me, I think listening has definitely improved the space for uncertainty, the patience to deal with uncertainty, doing away with judgments, also being more empathetic and interested in the conversations. So I have grown more comfortable with silence, the conversation, which I realize it's a very important part in our conversations in communication. So these are certain internal changes which I feel after I have been a part of this program, and it's definitely improving day by day. Also, I'm more mindful about the inner dialogue which keeps on taking place when such conversations are happening externally. So, yeah, these are a few things I would like to highlight.
கிளைண்ட்ஸ் கூட இல்லாட்டி மொத்தம் கூட பண்ணும்போது யூஸ்வலா ரொம்ப டைம் கொடுக்கும். ஆனா இப்போ இங்க வந்ததுக்கு அப்புறம் இன்னும் நிறைய அதிகமா அவங்களோட டைம் வந்துட்டு அவங்க என்ன சொல்றாங்கன்றத வந்து நாங்க லிசன் பண்றதை இன்னும் ஜாஸ்தி நம்ம வந்துட்டு பிராக்டிஸ் பண்ணிட்டு இருக்கோம். அப்புறம் வந்துட்டு எங்களோட சஜஷன்ஸ் வந்துட்டு நாங்க அவங்களுக்கு கொடுக்காம அவங்களோட இடத்துல இருந்து அவங்க என்ன சொல்றாங்க என்ன பேசுறாங்க அதை வச்சுட்டு அது மூலியமா நம்ம அவங்களுக்கு அந்த இடத்துல நம்ம ரிஃப்ளெக்ட் பண்ணிட்டு சோ அது பேஸ் பண்ணி நம்ம அவங்க கிட்ட வந்துட்டு வேலை பண்றது வந்துட்டு ஜாஸ்தி பண்ணியிருக்கோம்.
Yeah, so just to translate what Mr. Vijay has stated in the video, he says that even previously we used to listen a lot when our users share their concerns, but now there is more specific focus on the voices that they bring to the table, and also instead of just sharing our suggestions or telling them that what needs to be done or what could have been done better or what are the different ways to do this, now we are focusing more on inviting their perspectives and reflecting on those perspectives, and that is what changes he has witnessed after taking up this course.
Yes. We were using the dialogical practices, but now I see so much of change, the quality improved after joining this OD program, because before for me it is difficult to tolerate this uncertainty, and now I'm able to tolerate it
and listen to that also. And during that time, what my inner voice is saying, and the reflection part also improved much better. Like before, when we do sessions, that was more of, like Vijay says told, like solution oriented. Like from the beginning, we will be finding one or the other like solutions or conclusions. But now it's like more open discussions, so that by end somehow the person will be benefited and the team will be benefited. But it's, I feel it's kind of natural thing. It's naturally happening now. And no, acting immediately on a particular call, setting the particular meeting in a very no convenient place or convenient manner and convenient time, all those things, like we are carefully looking into all those aspects. So whatever we are learning from this open dialogue in those 7 principles, what all possible in our setting we are using, and I feel the quality of our sessions increased much better. And the solutions are also now it's interesting, because we have solution A, solution B. It's coming naturally, and not struggling
as earlier, which has really come down a lot. And like most of them were telling, the tolerance of uncertainty is one thing, because I never had the patience to listen to any patient fully. Okay, and I would always tell them, like cut them short and things like that. I stopped doing that, which is a major thing for me, because I see patients opening up more to me, finding me more approachable because of this, because I'm not curt anymore, and it was almost like business. Okay, what do you want? Yeah, is this your problem? So we'll do this, and that's about it. But now I've stopped doing that, and at that moment, like they open up with so many more things, like what are the needs they have, and how else, we can represent ourselves as a dialysis association better to the government, like what are the actual needs that people want, instead of my perceptions alone. So I think this has been great. And earlier, my inner dialogue was always a babble, like too many voices, and I used to just dismiss them all out. But after this course, I've started focusing on every voice that I get to see if it has a point. Oh, maybe we can also, approach it from this way. Earlier, like even the circumstances, like sort of snuff you out. But nowadays, I don't let that happen. I let myself listen to myself. Instead of wondering if I think so, what will others think of me? Or if I voice this, what will others think? That was very prevalent earlier, but it is not so prevalent right now. A lot of clarities come in the way we think and how we want to approach a problem or, any kind of a situation. So open dialogue has really helped me in a lot of ways.
இப்போ வந்து what I felt was, since I had taken a break from my work, Banyan, the open dialogue course, am I audible? Yeah, okay. The open dialogue course, it really taught me the art of listening, which I didn't have before. It is helping me personally, because I tend to hear like what everyone wants to say, and I know in the long run it will help the clients with whom I'm working. And see, I'm always this what to say, I'm aggressive in conferences, all that, but because of my passion and all. But now I have sensed that you need to listen even to people who have their ideas different from yours. So the art of listening, which is helping me personally and which will definitely help me in the future, that I can tell. And in enrolling in the OD, it was really interesting when they said that they will have the person with the health issue, that is the client among them, when they do have this counseling and all. Every time when I think of it, what about if the caregiver is gaslighting, how they will be able to find that? the caregivers are gaslighting, or if the client is very this one, that the caregivers feel burnt out, because these all are the main things, two things which always we know about it. You need to have so many sessions to have it. But I have always this feeling, how do you tell? And even as a person in your family, how do you say, see, you are told this, it's like gaslighting, because caregivers tend to, even to accept the fact that they are gaslighting. So I think like that the clients with whom I will work, how will they be able to find out even that the person is gaslighting against them? So that has been my main, I have been thinking about it a lot, but I'm very grateful that I'm doing this course because it is helping me a lot. The basic thing, that's what Arvind or Shah.
So, for me, I think
So just to give you some example of the part of the course, this is, here the course is really, for me, extremely interesting. Really thanks the Banyan, because there are 23 people, all different. I mean, there are professors, teachers, professional, peer workers. So it's really such an interesting and live ambience. Thank you for joining. Who would like to start?
So, good afternoon, everyone. It's a pleasure to talk to you all, and it's so encouraging that you're all still, ready and willing to listen, and all the other things, the Banyan team and everything. But Pina is something great fun. In our training, I remember the little bit of, the Bollywood songs, right? Italian song from Great Gambler. What is that? So we sang it to her. And but the main thing was she made it so homely, just like the open dialogue approach itself. So I learned, we ate the biscuits, the biscotti that she gave to all of us. And it was Basi the Dama, kiss of the lady. So it was really fun like that. But during the training, what we realized was that the Banyan, we largely do, because if you saw all the things, there's a best practices anywhere. But what Pina and Sakula and all of them have done is to really streamline and standardize it and give a kind of theoretical structure to it, so that when we do it, we feel as even I think Punita or somebody else was saying that each of those things segues into the other thing, and that way we can give this thing. And one more thing is, we all are too much in our heads and our mouths, right? So this was something where we could listen to our own bodies, our own inner dialogues, and listen to the other person's inner dialogue, not only from the mouth but also other things. So for me, the initial thing, what you said and what we heard about, was that how this dialogic approach was used in institutions, especially mental health institutions like Cuckoo, One Flew Over the Cuckoo's. See the kind of hierarchy and hegemony and domination and things that happen. And schools, obviously, again, schools are nothing but jails with the, headmaster and the teachers and all that, So, and corporations, and probably corporates also. So, everywhere, a dialogic system, helps in bringing down, toning down those power structures and making the more silent and lesser voices to rise up. And anybody would say, as a psychiatrist, I'm not so assertive, but even then, there's something that comes with your age, with your degree and everything, and I was present to those kind of imbalances, and it gives more, in a way, it gives you more power to know these things and how to tone it down. And also work in this kind of a thing, it brings in a lot of psychotherapeutic approach, of course. In a basically very biomedical approach, you bring in a lot of psychosocial and cultural aspects. every time I have to think, is it more of mindfulness? Is there a lot of a transdisciplinary approach? So it's a very eclectic method, and what we call as wicked problems, like morning we were saying, this, it's so complex and it's so persistent. So we need these kind of approaches. And one thing is, when so many stakeholders are brought in together on the same page, then a lot of communication issues automatically get cut off, and there's a much more powerful interaction that happens, and and for the therapists themselves, for us, for example, if you have another open dialogue practitioner with you, it's so much useful. Like me, Keerthana, and Lakshmi Shakra and all, we used to do this kind of a thing, and I found it very, very different. And the way we get time to reflect, those kind of things, and the many different techniques. Some of them may be taken from other places also. Like you take a photograph, you bring it out, and then reflection on that. So these kind of things make it very interesting. Or the fishbowl, those kind of things. The whole learning was also fun, and the therapeutic outcome. Now, another thing that was present to, I think, Dr. Kishore and all, we would be see, generally they say the outcome for schizophrenia in third world countries is better, paradoxically, for all the inputs. So I was just thinking, I'm just hazarding a guess, maybe what they're doing in open dialogue is they're creating that village system. It takes a village to bring up a child. So in a way, we are creating for that client a village around them, a support system. And maybe that's why the outcomes are better. Also because the community interlinkages are improved. So like she was saying, the incidence of new cases coming up, incidence comes down, the prevalence also comes down, and what we do in a technical thing like social skills training for residual schizophrenia and all that, negative schizophrenia, this kind of thing I think naturally happens here. So yeah, so lots of things we could just go on, and I was also looking at the slides and thinking, oh, so much more to inculcate. So I think, lastly, one important thing, India is such a structurally very difficult place, very challenging in so many different ways, and this north-south divide is there, not just globally, but in India itself. And there's so much of color, there's so much of caste, there's so much of class, there's rural, urban, all kinds of divides. So I was also amazed with Vijay's sharing. So that's, I think, credit to Pina and to the open dialogue system that it could get transmitted there. So I dream of open dialogue going not just in Banyan as an institution, but also in communities, and probably in a political dialogue where, how the dialogues are on TV and everything. So maybe if we could make because the open dialogue actually makes people's voices and thoughts come out, but there's an intrinsic grace and a system which supports you to say it in a safe space, but at the same respect the other person. So that is something our society needs, whether you're dealing with clients or other political issues. So yeah, these are some of my thoughts.
For me, open dialogue is very special because it has really changed the way I approach a scenario or a situation. Because those days when I was very new to the profession, it was always I versus the client, but now it is like us versus the problem. And if you remember Dr. Pina, we were the first batch of students who did the open dialogue, and during our first day of a class when we were discussing about open dialogue, its origin and all those things, at the end of the session Dr. Pina said the suffering needs a voice. That changed my whole approach towards my care practices, where now my question is not what does this person want, but my question is now what is this suffering trying to say, or how do I give a voice to this suffering, how do I make this voice heard. Now that has changed the whole way I approach a particular scenario. and also hearing everyone's voice, because generally as care practitioner, at least if I have to talk about my own self, I always have a notion that probably the caregiver has to take more responsibility, or probably the caregiver should have paid more attention. But then after started engaging a lot of open dialogue, and when we started to have lot of discussions and dialogue with the caregiver, the users, the problem and all those things, there was one particular session where we were having this open dialogue session with the whole family and the user. And then in the mid of the session, the caregiver said, "I'm feeling suffocated." The moment we were like, two co-therapists and the user, the caregiver, and everybody were all sitting together, and then the caregiver said, "I'm feeling suffocated." And this dialogue or this voice turned the entire way the user started to pursue the problem. Then we started to have a lot of discussion around this particular voice feeling suffocated, and then we had a lot of dialogue with the user on when the caregiver said this particular statement, what kind of feeling or what kind of thought process the user, and this changed the whole narrative. And more than working when using open dialogue with our own users, this has also changed my approach towards the way I have my team meetings. Because every time I see my team member, I just see only that particular role she plays or he plays, probably a role of a healthcare worker, a role of a personal assistant. But then, I was not cognizant of the other roles he or she is playing in their own life, like role of a mother, a role of a father, a role of a son, a daughter, whatever it is. And as a program lead or whatever, when I say certain things, when I say given particular instruction, now I am cognizant how the mother role she is playing perceives this particular voice, or how the daughter role she is playing perceives this particular voice. And this has changed the whole way I approach my team member, and the quality of relationship has improved to a great extent. So these are all the things I wanted to share. And right now, every day when I enter either an ECRC, an institutional setup, or at home again, or when I go to a home visit, the first thing earlier my first question used to be, are you keeping in good health? Because always my focus used to be, okay, whether they are fine, whether they are in good health. But now, after taking up this open dialogue, and after multiple, classes and discussions with Dr. Pina, my question is, how are you feeling right now at this moment? That opens up a lot of dialogues and a lot of, interactions.
So I was with Keerthana, again, one of Pina's students in the first batch, and Dr. Anbu as well. I have to admit that I haven't, unlike Keerthana and Dr. Anbu, been in a position to practice open dialogue in the form and shape that you've sort of seen now. But having said that, I think the good thing about open dialogue is that it's more about the approach. So you can use it as a therapeutic practice in exactly the same form, making sure that the protocols are the way in which they were outlined. But you can also draw from the values and the larger framework and approaches suggested and integrate it into other practices. So you don't, to that extent, have to show total fidelity. So, for example, what Keerthana said about, speaking with her clients and what she'd start off with about, how are you today? I think it was, we would do that anyway, but maybe what I would do now is also add another line to that and say, is there something that you're thinking about that you'd like to talk about? So having a way in which expression sort of takes center stage. Because I think expression pathways for people who otherwise don't communicate, and in some ways in our Indian society, as much as we feel the sort of feelings that we feel and think the sort of thoughts that we do, we unfortunately do not have the opportunity to share this with even people in the family, leave alone other stakeholders or in larger platforms. So very often, the impact of caste-based discrimination or violence at the hands of an abusive husband is something that would stay with you and will not find, an expression pathway. So I think open dialogue in the Indian context encourages expression because of the questions that practitioners are trained to ask that sort of spurs conversation. So I think it can be, it's dialogic, and there's a framework, and there are protocols, and you can show complete fidelity to that, and that's the ideal situation. But in the absence of being able to do so, if you draw from the values, then in the Indian context, I think expression and dialogue is promoted, and therefore the ability for people to find words to communicate their messages. So for example, when we sat in a group, one of the women, when we asked the question, so you've been through this experience now, and what do you feel? She said, I feel like there is a book of grief that's residing in my heart. Now that's such a profound statement, and in normal circumstances, I don't think it would have landed the way that it did. So that is one. The second is for some of us who by nature are somewhat talkative sometimes, I think, just listening and actively listening, along with a co-therapist if possible, brings in not just a culture of listening, but also focuses on the hierarchies that otherwise dominate therapy. Not that in every other form the therapist is speaking, that's not really the case. And this is not so much to plug open dialogue, this is just to talk about the impact of open dialogue on me, because as an individual who otherwise wasn't really drawn to therapy, I still am not, this is one form that has resonated with me. And I think this is the second reason, that it sort of instills in you the sense of calm and power in silence, and allows for you to intuitively also somehow recognize the power of silence in the other, and therefore sort of maybe even provoke a dialogic engagement. And I think that is key, because beneath that silence may be just absolute confidence, beneath the silence may be the need to just sort of keep things confidential, or maintain a sense of, or be private. But beneath that silence also may be a lot of trauma, or the role of culture, and therefore the need to not say things that are supposed to be within, as they say, the four walls of a home. Especially in the Indian context, it translates literally, "Namba veedukulla irukkiradhu velila solla thevilla." So whatever is in your house, let it remain in your house. We don't have to talk about it outside. Two more points. So for those talkative I mentioned. But the third is in the context of homeless people with severe mental illness, because that's also the group that we work with. I think two of the principles are extremely critical, and therefore people like Anbu and Keerthana and some of our other colleagues who probably practice it more than I do, much more, would find the principle of immediacy extremely important. Because when you have a homeless person on the streets, or when you have a person experiencing an acute episode, and in the background of the adversity that the person faces, in the background of loss of power, in the background of rules and legislations that could section you or that could whisk you away into hospitals. I think for teams that are trained in open dialogue, it allows for the person to access another option such as this, that perhaps is not an infringement on the individual's rights. So you can then engage in that dialogue on the streets. You can continue the engagement over a period of time. And then when the person is prepared, the person enters a care center if the person so desires or chooses to, right? And often the person sort of decides that the person wishes to. And finally, the last point is that open dialogue is not clinic-based. So it breaks a lot of hierarchies, and in a country like ours, takes a support system that is therapeutic to villages, to homes. And ideally, if it's, I'll just speak about one of the challenges, but ideally, if it is adopted and if it can be taken to scale, then you'd typically in villages be having people trained in the system, including people with lived experience and others, who could adopt these principles and use them in ways in which they would be able to respond to a crisis and respond using these frameworks and be tolerant of uncertainty, which is something that we have to learn to live with in the Indian context, especially in the case of about 70 to 80% of our population that lives with very limited resources, doesn't have access to public mental health systems, or to immediate respite or even secondary care. So in that context, I feel that open dialogue sort of comes in very, very handy. The one challenge is that from a human resource point of view, unfortunately, we aren't well resourced, but I did provide an alternative of many different kinds of people coming together. But 2 trained therapists, we aren't able to find 1 for 1 million. So 2 is a very difficult it's a challenge, though the advantage of 2, I have seen it play out in my own life. But if the same principles can be applied to people who are non-clinicians, non-psychologists, non-clinical social workers, and if the same principles can, then it certainly is something that can be easily adopted and taken to scale as a method that is democratic, that is focused on the person, that focuses on voice, which is so important in the Indian context, and that works with support networks close to home. Support networks, again, in our Indian cultural context are extremely important because it's never the individual, it's always the family as well that's engaged in the crisis, or the village that's engaged if there's a homeless person with a mental health issue. I'll stop there.
I think I did OD in the second batch, so right after the 3 of you, I was in the batch after. I think when I joined the course, I joined because one, I had just started practicing with clients at the time, and I wanted to try and understand another approach that could work. But also, I was looking for open dialogue to also just help me better communicate personally as well in relationships, in just interpersonal relationships in general, because I felt that oftentimes I would hold back from expressing something because I would be concerned that, what if I hurt the other person's feelings and things like that. So I was looking for it to just generally help me better in life. And I have to say that honestly, at the start of the course, I was a little skeptical about how this would pan out, only because it was a lot more unstructured compared to a lot of other therapeutic approaches that I was used to, that I was trained in, in training in psychology or clinical psychology. And I found a lot of comfort in that structure with other approaches, because you were told what tools to use or what to say, how to use these tools. There was a sense of concreteness that came with those approaches, and the lack of it in OD was intimidating for me at the beginning, because it was a lot to do with looking inward and a lot of introspection, a lot of reflection. And I think, like somebody in the video said, recognizing the different voices that you are experiencing and getting in touch with those different voices and being able to actually being attuned to all of them, right? So I think that it was not easy, and it took a while to really understand, while there is a lack of structure, there's also a lot that you can actually pick up in terms of what you need to be doing, right, in these conversations, and how do you want to show up as yourself, as a therapist. When I really started to see OD shifting things for me was when I saw changes in the group dynamics that we were working with in the classroom itself. And this was also at a point where I think, the pandemic had just hit, which meant that we moved from doing classes in person to entirely doing them online. Despite this, and despite it being a very mixed group, and in fact, I remember with the group that I was in, many of the participants were not from a mental health background at all, and they were just doing it because they wanted to be better communicators, I guess, in their personal lives. And despite it being a very mixed group in terms of age, in terms of background, over time, the dynamic shifted so much, and people just started, being a lot more attuned to each other's emotions amidst a pandemic, being more also perceptive of each other's needs, of each other's experiences. There was a lot of shared vulnerability. People just sort of intuitively held space for each other, I think, with Pina and Rita's support and guidance in terms of reflection. So I think that's what really shifted for me when we were doing the classes and seeing those group dynamics shift. I think for me, professionally, I haven't gotten to use OD very much with the population that we work with at the Banyan, but in general, in therapeutic work, what I've noticed is OD has also helped me question the role or just my ideas of a therapist itself, because I think also, again, we look at therapists as having to present ourselves a certain way, and a more conventional sort of an approach in terms of picking up what the client says and having to reflect and having to sort of be sort of like, I don't know, at least conventionally when I was in training, I've always felt like I needed to be prim and proper in terms of what I say and what I hear and respond. But I've also realized that what is actually very supportive is also presenting yourself as authentically as possible. So even if that means using humor in your sessions, or just having a light moment with the person that you're speaking with, or saying something sometimes that's not maybe the most therapist-like response, right? But that sometimes presenting yourself authentically is what you and the other person in that situation need. And I think OD helped shift that a lot for me, because it made me realize that I don't have to be so conscious about how therapist-like I sound in that moment for myself and for the other person. And I think that was a critical realization and shift for me as well. Two more things that helped me professionally in therapeutic settings were, one, I also feel that sometimes, especially as therapists in training or people who just start practicing, there's a lot of pressure we place on ourselves. We place a lot of the onus on ourselves to drive change and to make things better for the other person, which of course you can't take. You can't place that kind of onus on yourself or on one person. And I think, again, OD helped shift that, because it became more about a collective coming together. And it's not just about you or the co-therapist, but really about everybody in that situation having a conversation. I think so that was an important shift for me as well. And about also, the role that other people play, even if they're not really there. Because I think when we were initially in classes, one of the concerns that kept coming up for me was, what if, a family member can't be there? What if they, ideally it'll be great if everybody can be there, but what if they're not there, right? And I think what Pina, you had mentioned back then is it's not really about them physically being there, but also about us thinking about what their presence in that situation might mean, right? So even if they're not there, what do you think they might say, for example, if they're in that situation, or what do you think the dynamic might be like if they were actually with you? So I think that was also very important for me, to also make sure that the conversations we're having in that space are not just about you right now, but also about the larger situation or the larger ecosystem that you live in, and how can we bring parts of that into that session. So yeah.
That's a transformation. Like she said, teacher from student. I think suddenly I'm called also. So, yeah. Yeah, tolerance of uncertainty. But we expected, some of the students are here. So one student next to me said that maybe you will call, so she left. Yes. So this, the principles, the 7 principles, there is one book called 7 Principles of Highly Effective People. When I looked at this 7 principles, that's what I heard. So how these 7 principles, not only making yourself effective, making the other people effective. So the practice for me is only with the students. That's what I always tell her. With the students, all these principles are very helpful, because there are a lot of conflict in the way you present certain theories or discussions. The students come out with their own reflections. Suddenly you feel that should I take that from an expert perspective, or taking things as it is. I think in that way it changed me. So more collaborative environment, that I at least attempting to facilitate within my own classroom environment is one. And in my family also, everyday open dialogue happens. Recently, just a week ago, one of my close relative attempted suicide, and we were called in. I attempted open dialogue there. Because in the past, similar experiences, I always talk to the family member separately, the person separately, and if there is a child also separately. In this, actually I brought the child also, 12-year-old, asked what the child feel. Though the family was not in favor initially, but the child had more insights on what is happening, in the family. The way the child addressed, the issue, really insight for me and the parent who attempted it. It helped us to even take a call for this person to get admitted into a facility. And then there are other relatives also came into the picture, their parents and the wife of this person. So this is just a recent, just a week ago experience. It's very powerful. Thank you.
We have now 15 minutes, a bit more, for some interaction. May I ask you to just share, just the two of us, the ones that are close, just 2 minutes, I will give you the time. Share your feelings in these moments, listening what you heard. How do you feel with it? and what make you think about? Just 2 minutes, please. If just two of you, yeah, each other, just share. How do you feel now here, listening what you heard? What solicitate in yourself? Is different? Is similar? Is very different from your habits? Just two people, two. Please just share.
Open about it to each other.
Turn to each other, two people. So, you can come back all together, please. And now we have some small time, if you want to share. Someone would like to share the contents of your exchange, or something else, or a question, or whatever is in your minds. We have time for a few of this sharing.
I'll take this too.
Yeah.
Hi, thank you. So this is my first exposure to OD in thinking through and listening about the principles and all your experiences. And as you were saying, what it's done to you personally and professionally, I feel like it's something that I need to undergo as far as a course, because listening is hard, and I feel like when someone else is talking, I'm listening, and if I don't say what I have to say in an appropriate moment, then the time is lost and the context is lost. But it's not important. You know what I mean? Like, there's not always the need to say what you think when someone else is speaking, and there's the importance to listen. So I think I'm going to enroll at some point. So thank you. Thank you for this. Appreciate it.
Yeah, so that's what Sanghamitra shared with me, and what I was telling Sanghamitra was, Dr. Pina said, you can talk about yourself and what you're going through, though necessarily it's not about me, it's about the person who's in front of me and the family. For me, self-sharing has always been difficult. So what I wanted to ask all of you was, in your practice, how important has self-sharing been, and how has that played out in helping the people that you seek to help? Yeah. Yeah, sure. Thank you.
Someone else feels to share that.
This is about dealing with the resistance. In a therapeutic situation, in a clinical context, we do come across people who could be resistant. And therefore, resistance can lead to more conflicts. What is the process of dealing with resistance in the tradition of open dialogue? Does open dialogue believe in confrontation, or does it believe in allowing the resistance, maintaining time for uncertainty, so that the issue comes up? And how much of time is given to deal with this situation? Sometimes resistance can be a very enduring kind of a process. I want a response for that.
So sharing the content of your conversation or your feeling, whatever you like to share.
I have a question. Sorry. So we were just discussing that when we're doing this in a family setup or anything, or even with a bunch of folks, and as a practitioner, we're trying to maintain openness, empathy, we're listening, all of that's happening. But there's a lot of things can fall apart and the family members might not maintain that same level of openness. So how, and I'm sure like doing the course would teach you tools for that, but that like anything you can say to that also. So when you're engaging with family members who are facing a difficult situation, have differing perspectives, which can fall apart, turn into not a pleasant situation where people are not practicing the same values as you are. So how do we also navigate that?
Excuse me. I start from your question that maybe can englobe also the others about when you meet a family where you can feel that there are some issue, you don't have the same value. That is not so infrequent. Could happen also in between the therapists. So you are working with someone and you discover that you don't have the same vision of the situation. And it's exactly the same thing, how to deal with a different vision, different value into the situation. The first thing that I feel to say is that in any case, respect and acceptance is fundamental in any meeting, encounter with everyone. With friends, with neighbors, and in a therapeutic session. So allow to the other person to express their point of view is fundamental for the communication and for the relationship, for the human being meeting another human being. It doesn't mean that you have to accept what the other person is saying, that you have to agree with what the other person says, but you have to, in any case, somehow respect what the other person is saying, and you can express in a polite, sincere way that you have a different vision in that situation. Maybe this can be of some help. The point, I think, is which is the difference between a discussion, a common discussion, and a dialogue. In a common discussion, your need, your desire is to prevail. This is my vision. And even you can cut the word of the other one because it's your vision that you want to affirm. So it's a debate where your goal is to win somehow. In a dialogue, your goal is not to talk, is not to win. Your dialogue is to create and facilitate the conversation. So your goal is to create a safe space for what people can express themselves, and no judgment, especially in a therapeutic session. I think personally I can say function also in daily life to create better relationship. But we are talking now about a therapeutic session, and you can express your being with a different vision, position, but this doesn't mean that you have to win. And just allow to express, maybe you can ask something more. You can ask something more. Can you tell something more about what you mean with what you are saying? Maybe this can make better understanding, because many times we disagree because we don't listen very well what is going on, and so we just disagree because our main goal is to be me saying something, not me listening something. The curiosity of listening the other is part of the respect, and the respect, as we heard this morning, is fundamental in any kind of approach, whatever it is. So I think is this I don't know if someone of you want to add something.
I think the very structure of the interaction is such that it accommodates and allows for that. Without it being, like she said, in an ordinary discussion, it will become a heated me versus you, or who's all that. But here it is the respectfulness and the space is inbuilt in the structure itself. And that's what is fascinating in the thing. That's why I said, even forget therapeutic, where there is little more a little more alignment, right? At least at some level we are all agreed that we have to help the client. But think of a acrimonious public debate, or so even there, if this kind of a system is structured, if we learn as a society, I think it will help a lot. But yeah, even in a therapeutic situation, these kind of acrimonious things can happen. As she rightly said, even between two therapists, even between two psychiatrists. We have just two types of drugs, but there can be a fight which class should go, right? So, but how you do that I think here, this structure makes it very, very intrinsically easier and more graceful way it can be done.
Hers. So is this, Pina, part of open dialogue, or is this a part of you? Yeah, I think because that's important. Because your response saying that you don't have to prevail. It's not about that. Because we've all, as a result of interacting with you, seen the principles there, and the common principles of value, non-judgmentality, all of that is there in many of the approaches, right? But in open dialogue, in addition to whatever else that we have seen, that you don't really have to prevail. It's okay to let it pass. Be respectful, but still communicate what you're comfortable with and what you're not. So how much of this is open dialogue and how much of this is you?
I can say is open dialogue, is the dialogical approach based on these ideas. Then maybe I like dialogical approach because it's part of some part, I hope, of my character. This I don't know, but for sure is about dialogical approach. Of course, there are different kind of communication. If I'm communicating in a very difficult situation with politician, and I want to get something for sure, well, could be much better to be dialogical. But sometimes need to also a debate, discussion, are different typology of communication. And being a bit more aware means that you can choose which one is more effective in that moment instead of another moment. In a situation where you want to create a safe space for a family, for them opening up maybe words that they never said, for sure, your intention is to be more open possible. You don't need to discuss a lot. Sometimes maybe you need also to discuss, for sure. The principle doesn't say that you have to agree, to smile, to be kind, to be positive every time. Sometimes you have to say also what you really think is important. But there are many different ways to say things. And this is the point.
Would that also be flexibility?
Exactly, yes. Yes. The second question, then I leave yours, Dr. Kishore, last because it's the more difficult. Share your own experience. I can say my way, and then we share. I was in the same position. I always had this difficulty to share my own experience, thinking why I have is not polite, is not correct. But then I understood this part of the spontaneity of the relationship that you create in that moment. But for sure is a very delicate point for me, because the risk is that you tend to take the stage, take the place. The place is not for you. So great attention on just make some referment to yourself if this you really sincerely think that could be of some help for the other person. Many times function, sometimes not, but okay, we risk. Someone else want to add something on this point?
Yeah. So in my case, Sumana, all through the 3 decades as a mental health professional, I've allowed for boundaries to blur, and that's the one way in which I'm able to make a connection with others. And I spoke about this earlier in my on day 1, because I think it flattens hierarchies. Not so much to do with open dialogue, but that's just me, and I just feel that it really doesn't take away the other person's space. Or people also talk about these days that when somebody says something, if you tell them, well, I've shared a similar experience, you're taking away from that person's experience and focusing on yours. But I think the right moment to do it and paying it only the sort of attention that is required is probably what is key. But sharing has always helped. The reflection that we refer to here in open dialogue is not so much sharing as much as the session is in process, and I think one needs to see how that works. And then the therapists reflect their perspective, so it's entirely theirs, on how they feel about the episode and about everything else. So it's not sharing of your personal experiences, but you're sharing of your feelings about the situation. So it's not removed from you, and you're as vulnerable as the other person.
Thank you, Vandana. This was a very important point. The last about the resistance, of course, is one of the main difficulties when someone does no compliance, doesn't feel to take part to the conversation. And open dialogue would say, yes, try again, but mainly the meeting is not just between the therapist and the professional and the client, but it's with the network. And so the network could be very helpful in this kind of situation because you can involve the network and even ask help to the network for slowly involve the person, and sometimes contemplate also that if even the main client doesn't want to take part and goes away, you can go on with the family, just with the family, without the main client, and just keep the chair, the space for the person to come back, to accept the next meeting, the possibility to join. As Trieste experience, my own experience in the years, I would say just try more in a different way, involve more network, involve the neighbors, one time I remember we involved the mayor of the town to convince someone to come into the service. So just not violence, but try more, try in a different way. Sometimes is not successful. There are also the situation where, unfortunately, you have to take a strong decision, but you can take a strong decision in a dialogical way, a paradox, but it's true, communicating, sharing the decision, not just taking the decision and doing it, but sharing the decision, even if it's drastic and sometimes dramatic for the person decision, you can share with the family, inform the person, and that you do in open dialogue, but normally we used to do in our usual practice in Trieste.
Okay. This isn't fully articulated because I'm thinking out loud, so it'll be great actually if you can add on. But my reflection was more about the idea of resistance, because I think in some therapeutic situations, there is a sense of hierarchy that clients can feel, right? And there is a certain power dynamic between the therapist and the client, such that sometimes when a particular approach is not working for the client, and the client is withdrawing or not really engaging with it, sometimes we do look at that as resistance to change, but it may actually be resistance to that particular approach that we're employing. And or even if it's resistance to change, I think that also needs to be, I think, unpacked in therapeutic situations, right? And I wonder if what OD does or why it works differently is because it gives that client or the person the space to actually understand why or what that resistance or the discomfort with the change process itself means to them, and for them to be able to also express and articulate that along with the person who's facilitating the process.
Yeah, so I get what you're saying, Dr. Kishore. I feel it's a combination of what everybody has said, that try in other ways, use other approaches of dialogic practice. Is the person resisting because the person is not comfortable with the hierarchies or with the approach? But in some cases, it's also true that whatever that you're referring to as resistance, perhaps not the sort of resistance that we're talking about. So it's not resistance about approach, it's not resistance. So it's just, we're all finally, we have to take it for granted that if we're talking about mad pride, then all of us are also probably similar in nature. And you may have a mental health issue, but you also have your own unique personality. And I have seen an open dialogue video where the person wasn't, and this is in Pina's class, wasn't comfortable with the family, wasn't comfortable with the care system, wasn't comfortable with open dialogue, and didn't want to engage with any one of those options at that point. And it was the best foot put forward by every individual or every group there. So, so I think therefore, what's probably key is to know when to just stop something and stop with any approach at all, and to allow for time and space, and then to readdress a particular situation. Because it's not always that control and resistance yields the best results. So just let it be at some points. And that is true of us in our lives. I live with a mental health issue myself, and I don't like to be pushed beyond a point at some point. And in other situations, I do know that I'm pushing the other person, beyond a reasonable point. And therefore, I try to, take cognizance of that action of mine. But so there's always multiple identities, right, in us. So I think, and there's multiple roles, so.
Just to give, to continue what you said, because the video that you saw, this young girl that was resistant to the circle and to open, well, the unique result of that meeting was that she created a good connection with me. I introduced to an association of women that is in our department. It was this association creating the, I don't want to say the miracle, but somehow even yes, because 1 month ago I went to the presentation of a book that this girl wrote, and was her desire, her dream. So where you, as a therapist, maybe cannot move something, maybe there are other situations, more social, more informal or different, that you can create a link and overcome the difficulty. Her difficulty was to be considered ill, and so she cannot stay in that situation. Moving was something that really helped her. So there are different, to put together different modality, I think, is always richness and not think of nothing.
And what was very important for me with open dialogue also was that it wasn't communicating difficult information, because very often the most difficult task for us is to say things that may hurt or we think may hurt. Sometimes the truth hurts, and the way you say it, the intentionality involved, all of that plays a role, right? But sometimes one does have to express complex emotions. And therefore, the approach in doing so, and yet speaking the truth, but for the intentionality to be that of connection, and for the environment to be safe and equal, and for openness, really, to accept whatever the outcome is, but to keep with the truth.
Is it okay to close? Do you have something more? Yes.
Yeah, so first of all, about Sumana's thing about self-disclosure, again, it's the flexibility and being empathetic to the person. I mean, can the other person hold it? Will it help that other person? So you have to be present to that. Indiscreetly sharing even though it might resonate with you, something that they share might resonate with you, but you should be very careful whether it will help the other person. So you need to be sensitive to that. And the other thing about what Dr. Kishore was asking about resistance, and Pina replied about sudden, at a stage, hard decisions, which means involuntary admission or injections have to be done. But what I have found is then when we continue the dialogue, because open dialogue kind of makes us feel okay to keep communicating. See, for example, if the person is speaking something unintelligible, but we still think that there is some logic in what he's saying. So there is a brain logic, for example, because there is aphasia or something like that, right? Receptive aphasia or whatever. But you still try to negotiate because it's coming from some point there. So that way, even the person is not communicating with you, but you are communicating with that person and expressing why you're taking a certain thing. So I have seen that when the client recovers later, they say like, I'm sorry for whatever, or I'm glad you took that thing and I'm now telling you. So it's amazing that they were actually in a sort of locked in kind of a thing. They are seeing you and they're not answering, or they're saying something else, but some part of them was listening to and also getting what you said. Yeah.
So I think it's time to close. Thank you for assisting.
Thank you so much. Really appreciate everyone's time. We just have to make a quick announcement. I do want to do a vote of thanks, but could you all please look under your seats? It's a bag like this. Every one of us has a bag like this. One of our speakers is missing their bag. It's got a green purse in it. So if you just look around in the bags that are around you, it's not Pina. It's Tiruchelvi's bag. So if you do see a bag with a green purse in it, this cloth bag, appreciate that. Thank you, Dr. Pina. Much appreciate your time. All our panelists and speakers along with Pina. Thank you. A round of applause. And this really, unfortunately, formally concludes our conference, our 3-day conference. Really appreciate everybody's time, all the time that you took to be with us for the 3 days. I wanted to do this in the morning, but we hadn't formally concluded. But just a round of thanks. If you found that your travel, stay, and just overall experience in Chennai has been lovely and wonderful, if it's your first time and you love Chennai and you love this experience, and if you returned and you still love this experience, we've had a fantastic conference logistics team that's made this happen, starting with Ashok sir, Viji, Saumya, Swati, Hita, Paroma, Mrinalini, Shambhu, and Deepika, supported by our senior management team, and Vandana, and many, many others. We've had interns and research associates planning this for really months. So we want you back. So if you found this a lovely stay, please find them before you leave and say hello. And we'd hate to say goodbye, so we're just going to say until we see you again. And keep in touch, and wish you health and happiness till we see you again. So thank you very much. Appreciate it. 3 cheers for me. Last but not least, I would like to invite Dr. K.V. Kishore on stage for giving a special gift to our lovely photographers, the young women who've been painstakingly documenting everything, making us look good on camera and media. We've got a small gift for you, if you please come on stage.
Trisha, Vinodini and Rasya Banu, they are from Vyasai Torargal. I think they've been on their feet all through the 3 days. Huge, huge thanks to you.
Take a photo.